For Jurgensen's test, purpose is to test for bicipital tendon dislocation. The patient is seated, the practitioner is off to the side. You bring up their arm into a 90 degrees, hold resistance, and as they push in, you pull out their arm. Oh, you're not supposed to be stronger than me. And positive test is pain, which would be dislocation of the bicipital tendon. For Speed's test, purpose is to identify bicep tendonitis. Patient is sitting or standing, practitioner is off to the side. You put your arm into flexion of 60 degrees. With your palm up, palpate the bicep tendon area, and you resist as they push down, as they push up. Positive test would be tenderness or pain in the bicep group. For the wall push-up, patient is up against the wall with their hands flat and arms straight, and practitioners off to the side. The patient flexes their shoulder blades inward and outward without bending their arms. Positive test is pain or inability to do so. Cross arm test, purpose for AC joint and arthritis. Patient is seated and practitioner is off to the side. Patient brings their arm up to 90 degrees and then touches their shoulder. Positive test would be pain. Hawkins-Kennedy test. Purpose is for ligament damage or on the coracoid process. Patient is seated, practitioner is off to the side, and the patient brings their arm up to 90 degrees, and then you externally rotate it. Positive would be if there's pain.
So is that it to it?
Belly press test for examination of the rotator cuff. Patient is standing, practitioner is off to the side. Patient takes her arm onto their stomach and presses for rotation of the rotator cuff. Positive test is inability to do this. For Apley's scratch test, purpose is to find the range of motion of the glenohumeral joint. The patient is sitting, practitioner is off to the side. They're to touch their shoulder from the front, touch their shoulder from the back, and touch their scapula from behind. A positive would be the inability to do this. For Roux's test, the purpose is to test for thoracic outlet compression syndrome. The patient is sitting, the practitioner is off to the side. For the procedure, you abduct your arms, and then you rotate them 90 degrees. Close your fist rapidly for 1 minute. But since he can maintain this, he doesn't have lessened motor functions or loss of feeling, he's fine. So we're not going to do it for a full 1 minute. For Adson maneuver, which is for the purpose is thoracic outlet compression syndrome. The patient is sitting, practitioner is off to the side, feeling the radial pulse. The patient abducts their arm 30 degrees and with their thumb up, extends shoulder back and turns to look back at it. And since he doesn't have a diminished pulse, he's not positive. For Allen test, the purpose is thoracic outlet compression syndrome. The patient is sitting, the practitioner is off to the side, feeling the radial pulse. You abduct the arm, bring it up, rotate 90 degrees up, rotate your neck away. And you don't have a diminished pulse, so you're all good. For the spring test, Test for AC and SC joint sprain. The patient is sitting, practitioner is off to the side. You push down on the injured joint. If there's movement or displacement of the clavicle at the joint or pain, that's a positive. Do you feel pain? For drop arm test, purpose is to find a rotator cuff strain. Patient is standing, the practitioner is off to the side. They're supposed to bring their arm up and slowly lower it to 90 degrees. If they cannot keep their arm there, or it has pain, or the inability to slowly return, then they're positive.